Warranee, my name's Karen Thew, First Nations Health Access Officer for the P18 here on beautiful Darkinjung land on the Central Coast. I would like to welcome you all to session 4 of our Quality Improvement Program for Practice Incentive, Indigenous Health Incentive and CDM. I would like to pay my respects and acknowledge the elders past, present and future as the traditional caretakers of the lands on which we are working on today, and pay my respects to any First Nations participants joining this presentation today. I'd also like to recognise and celebrate the diversity of First Nations people and ongoing culture to the lands and waters of our country. In this presentation, the learning outcomes for the Practice Incentive Program Indigenous Health Incentive is how to successfully integrate the PIP IOHI into your practice to maximise benefits for your patients, and best practices for delivering culturally appropriate care and engaging with First Nations patients and their communities. It will also improve health outcomes of First Nations people and enable your practice to contribute to closing their health gap and encourage practices to prevent, identify and manage chronic disease. It also encourages practices to actively engage with First Nations patients and to promote a collaborative approach to healthcare. The Practice Incentive Program Indigenous Health Incentive encourages health services to meet the healthcare needs of First Nations patients, which includes best practice management of chronic disease and mental health disorders, and also supports practices to close the health gap experienced by First Nations communities. Chronic disease is responsible for 66% of the health gap between First Nations and non-First Nations people. The Practice Incentive Program Indigenous Health Incentive encourages continuing improvements in general practice through financial incentives to support quality care and access to improve health outcomes for First Nations patients. For your practice to be eligible to participate in the Practice Incentive Program, you must meet the Royal Australian College of General Practitioners definition of a general practice and maintain full accreditation or be registered for accreditation against the RACGP standards for general practices. A practice needs to actually achieve full accreditation within 12 months of joining the Practice Incentive Program and maintain accreditation thereafter. The practice can be assessed by an approved accredited agency, and you can find out more about this on the National General Practice Accreditation Scheme website. For a practice to apply for the Practice Incentive Program, you can do this online through HPOS using your Proda account or by completing a Practice Incentives application form. Once you've completed your online application, you'll just need to complete and submit the following: the ownership details and declaration form, your current accreditation or registered for accreditation certificate, evidence to support your ownership structure, or supporting documentation must include the practice. Practices already participating in the program can apply for the Indigenous Health Incentive through HPOS as well, using your Proda account. For the practice to register patients for the Practice Incentive Program Indigenous Health Incentive, a patient must identify as a First Nations person and give consent to the practice to register for the Practice Incentive Program. The practice can also use a recall and reminder system for all First Nations patients who have a chronic disease. And the practice must also have completed a cultural awareness training up to 12 months before they apply for the Practice Incentive Program, or currently be in the process of completing cultural awareness training. As part of ongoing confirmation statement audit process to verify that the practice meets the requirements and maintain and update practice and general practitioner details to receive updates from Medicare. The care provider. This means the practice provides the majority of care and intends to provide care to the patient over a 12-month period as a usual care provider and is responsible for the management of the patient's health. This would not apply to a practice that only provides one service a year to a patient. Patients must also confirm they want the practice written on the Practice Incentive Program Indigenous Health Incentive patient registration and consent form to be their usual care provider, and the practice is responsible for the chronic disease or mental health disorder management. There are also changes made from the 1st of January 2023. So eligibility expanded to include children under the age of 15 years. It also included GP mental health care plans with Medicare benefit schedule item numbers added as eligible items for the purpose of outcome payments. And the requirement to deliver a certain number of services in a calendar year replaced within a 12-month rolling window, starting from the first day the patient received the first service. And movement to a back-ended payment structure in tier outcomes payment eligible for under 15 years patients. From the 1st of November 2023, there was more changes with the Practice Incentive Program Indigenous Health Incentive. So the eligibility changed to include children under the age of 15 years who had undertaken a health check and identified risk of a chronic disease. Then the patient is entitled to 10 sessions with an allied health professional. So this aligns with the MBS changes implemented on the 1st of March in 2024. So patients under 15 who are registered under a parent or guardian consent will be registered until they turn 15 years. And then it's up to the patient to register themselves after they turn 15. The requirement to deliver a certain number of services in a calendar year replaced with a 12-month rolling window. So starting from the date the first eligible service is delivered to the patient. Changes to the Practice Incentive Program Indigenous Health Incentive from the 1st of January 2024, which I'm pretty aware that practice would know about these changes. So practice can start registering their patients for the next calendar year from the 1st of November. So in November 2024, lifetime registration will automatically be applied to all patients with an active 2024 registration who are over 15 years of age. You won't need to re-register these patients. With the shift to lifetime registration for existing Practice Incentive Program Indigenous Health Incentive patients, continuation of the gradual shift to a back-ended payment structure. So from the 1st of March 2024, First Nations only need to have either a CDM plan or a 715 health assessment to access up to 10 allied health services capped per calendar year. There will be no requirement to have both of these services. So more changes to the Practice Incentive Program Indigenous Health Incentive from the 1st of January 2025. There's no longer a patient registration payment with the shift to lifetime registration. Payment to practices will be provided after a threshold level of care has been provided. From the 1st of January 2025, all new registrations for patients 15 years and above will be lifetime registrations ongoing. I'll explain more in the next slides. So the sign-on payment for 2023 was $1,000 per practice. 2024 was $1,000 per practice. So from 2025, a one-off payment to practices that register for the Indigenous Health Incentive and practices agree to undertake specified activities to improve the provision of care to their First Nations patients with a chronic disease or mental health disorder. And then you'll see the patient registration payments underneath. So for the outcome payments for the Tier 1, chronic disease and mental health management. So 2023, there was $100 per eligible patient per 12-month assessment period, the same for 24 and for 2025. So now a payment to practices that either prepares and reviews a GP management plan or a team care arrangement or GP mental health treatment plan for a registered patient with a 12-month assessment period. There's also GP mental health care plans, Medicare benefit schedule items added as eligible items for the purposes of outcome payments. So the Tier 2 outcome payments for total patient care. So for 2023, it was $150 per eligible patient per 12-month assessment period. 2024, it was $200 per 12-month assessment period. And 2025, it's now $300 per eligible patient. A payment to practices that provide a target level of care for a registered patient within a 12-month assessment period. So the Tier 2 outcome payments to all practices that provide a minimum of 5 eligible MBS services to a registered patient within the patient's 12-month assessment period. This may include the services your practice provided to qualify for the Tier 1 outcome payment. I've also included in this presentation health pathways. Health pathways you can find on our PHN website, and there is information on our website how to log into health pathways. We have a First Nations health on our pathways, which are from the PIP IHI to closing the gap, health referrals, principles of care. There's quite a lot of information on our health pathways website. Please find websites on this references and citations slide to help practice managers and GPs access the practice incentive program guidelines and the Indigenous and health incentive, and all the forms are on these websites. Please fill out the survey as it helps to provide the First Nations team to improve on future presentations. Whether it's negative or positive feedback, we'd all like to hear from you. On this slide, I've included the link to our PHN website for First Nations Health. You can access all the presentations under practice support sessions on this website under the First Nations Health tiles. From the First Nations Health Access team, I'd like to thank you all for participating in this presentation and look forward to hearing your feedback. Thank you.